In this video, I'm going to show the #1 mistake runners make when trying to go back to running after meniscus surgery. Hey guys, I'm Dr. Kevin Vandy, physical therapist and running specialist with Competitive Edge. I myself have had 2 meniscus injuries, 2 surgeries. I've had a meniscus repair and a meniscectomy where they just take a piece of the meniscus out. It happened when I was in high school, right back to back. So I know what it's like to want to run after meniscus surgery. You're likely chomping at the bit to want to get out there, back on the road, back on the trail, but you're also probably a little nervous and worried that your knee isn't ready yet. Now, here's what happens often. I've been doing this 15 years. I've worked with hundreds of runners who've had meniscus surgery. And oftentimes, your surgeon, because they're focused on the surgery they did to the structure of the meniscus, will see you, and if you have no pain, and if you have no swelling and you have full range of motion, they'll clear you to go back to whatever you were doing before you had the surgery. Now that's great for the surgeon, but functionally it's not the best for you because that's not objective. It doesn't tell you, are you strong enough? Is your alignment correct? Do you have enough endurance? It doesn't take in those key factors that are essential for protecting your knee. So that isn't the absolute best advice. Now, oftentimes these days when you have meniscus surgery, some surgeons aren't even sending you to PT, to physical therapy. The problem with that is you don't have a movement specialist, you don't have a running specialist that can assess your form and assess your strength to be sure you're ready to run. So what I'm going to do in this video is I'm going to give you the reasons why it's essential that you do not go back to running too soon. I want you to protect your knee joint health. I want you to protect your cartilage, your meniscus, the undersurface of your kneecap, so that your knee stays healthy so you can run at any age for as long as you want without issue. So why do I believe you need to wait at least 8 to 12 weeks after your meniscus surgery to return to run? Now you might say, that's too much time. Kevin, that seems like too long. But in the time I've been doing this and the hundreds of runners I've worked with that have had meniscus surgery, that is the average we've been able to safely return them to run. Have runners gone back earlier than that? Yeah. Have they had issues? Sometimes. And I want to try to prevent that for you. So here's some of the science rationale behind why I think it's essential to wait that long. Number 1, it's likely that before you had meniscus surgery, you didn't have the strength necessary in your glute, your quad, and your calf to be able to handle the demands of running, which is potentially why you had a meniscus injury in the first place. So strength is essential. When you run, it's 1,500 steps a mile, and it's 2 times your body weight per step. So if you weigh 150 pounds, every time you step, it's 300 pounds of force that goes through your leg. And you really want that force to go through your muscles and not through your knee joint. Because if it goes through your knee joint, it's going to wear away your cartilage, it's going to increase your risk of arthritis, it's going to cause swelling and pain. You do not want that. So having the right amount of strength to handle the demands of running is essential. Well, how long does it take to increase strength? Scientifically, it typically takes about 6 weeks. When you first start a strength training program and you're in the gym, the first 3 weeks, what happens, it's just your brain and your body improving the neural circuitry to the muscle. That's it. There's actually no fiber changes. There's no strength changes that happen in those first 3 weeks of doing strength training. So if you've had meniscus surgery and you have no pain and swelling, you feel good, and it's been 3 weeks and you want to go back and run, I would caution against it because you haven't had the time to get your strength back. You see, right after surgery, you're going to have decreased strength of your quadricep, decreased strength of your buttocks muscle, your hamstring, and your calf just by having the surgery alone. And that doesn't take into effect that there was probably some weakness leading into your surgery. So you want to give it at least 6 weeks, preferably 8 to 12, to allow 2 full cycles of strength training to occur to get your muscles ready to absorb the load and absorb the force that's going to go through your leg. So that's number 1 why I feel you should wait to return to run and not make the key mistake of returning too early. The second reason why I feel you should wait to return to run to at least 8 to 10 weeks is for the health of your cartilage. Your cartilage is the outer covering of the bone of your knees, of your thigh bone and of your shin bone, and even underneath your kneecap. That cartilage is a living tissue. and it responds to stress. It doesn't like a lot of loading, and it doesn't like too little loading. It likes to be right in the middle. The problem with having meniscus surgery is there's downtime. It's likely a couple days when you're either on crutches or not walking efficiently, maybe even up to a week to 2 weeks. You have less strength, so you're not using your knee as much, and so the cartilage has less overall loading. So if you go from that environment to then, let's say you're 3 to 4 weeks out of surgery, and you go right into running, which is high loading, the cartilage isn't ready for it. You have not prepared it. You have not conditioned your cartilage to be ready to run. So our suggestion in my lab is that we have people start a walking progression where they're walking on a treadmill, they're walking inclines, they're hiking, maybe even hiking with a weighted backpack. That is a great transition point into loading your knee cartilage prior to running. Again, you don't want that light switch of going from nothing to too much. That is another reason why you have to wait and have a return to run progression where you walk to run or you gradually add more miles versus just going right back into the miles you used to run, which is a recipe for disaster when it comes to overloading your cartilage and accelerating arthritis. I know that's a tough word. I know you don't want to hear that. That's why I'm telling you this today in this video. So you want to make sure you condition your cartilage, you give it a chance to respond to loading before you return to run, which again typically takes about 8 to 12 weeks. The next piece I want to share with you is it's likely prior to your surgery you didn't run with the most optimal form and you added strain to the meniscus and to the knee. See, when you run, it's essential that you have your foot and your knee and your hip in alignment as much as possible. When they're not in alignment and your knee rotates in or rotates out, your foot pronates too much or your pelvis drops, any of those scenarios add load to the knee and specifically add forces to your meniscus. So if you haven't had someone analyze your running gait, that is a great first step. See your local physio, local running specialist, to have them analyze your running to see if you have any of those form issues. Because if you do, then you're going to need the strength training, you're going to need the activation, you're going to have to remind your brain where those key muscles are, like your glute. You're going to have to go through some form training to get your cadence right and your trunk posture and to avoid those alignment issues. Because if you just go right back into running the way you used to, it's likely you're going to add strain to your knee and potentially increase the risk of injury. So you want to get those form changes right. But guess what? Just like strengthening, that takes time. You need the strength of the muscles plus the skill practice of getting the alignment right to fully optimize that, which is why I suggest you wait 8 to 12 weeks to return to run to avoid the mistake of going back too early so that you can work on those specific form changes that will protect your knee for the long run. All right, so those are my reasons, the background to why I might be radical, might be different than you've heard from your doctor or physio, why I believe you should wait 8 to 12 weeks to return to run after having meniscus surgery. I know it doesn't seem like I'm being fair. I know it may seem like I'm keeping you from running, but it's for your long-term health. Again, the goal here is, can we keep you running for as long as possible? Most people that have meniscus surgery and are runners are usually in the 40 to 60 plus age range. It's at the time where your knee is already going through some early changes. We want to protect it for as long as possible so you can do the thing you love, so you can run at any age, at any time. And that's why I suggest you give yourself time to strengthen. You know, it's at least 6 weeks to strengthen, to load your cartilage effectively, through hiking with weight, and strength training, and finally getting your alignment right to reduce the forces on your knee that likely are adding too much strain to your meniscus. So those are my tips, those are my rationales for why you need to wait and avoid the #1 mistake with running, which is going back to running too soon. Again, my suggestion, 8 to 12 weeks, see your local physio, see your local running specialist. If you want more information about how exactly to do that, how to load your cartilage effectively, what the progression is for return to run, a walk to run program, the exercises to do, and the timeline for return, check out the link below. I've created a specific course called my Run Safe, Run Strong Return to Running program for those who have had meniscus surgery. Check it out. If it works for you, I would love for you to join the course and help you in your recovery. Guys, thanks so much for listening. Please like, subscribe, hit the notification bell so you get access to more of my videos. I appreciate you watching. I sincerely hope this helps, and I hope that what I shared with you today is the key you need to make sure you make a full and successful recovery back to running. Till next time, guys, train smarter and perform better.